Okay, sounds good.
Well, good afternoon, everyone, and welcome to Office Hours. This is Stephen Tweed with Leading Home Care and the Home Care CEO Forum, and this is Office Hours for April the 16th, 2020. Office Hours is an opportunity for some of our clients and friends and readers and others who are connected with Leading Home Care and the Home Care CEO Forum to come together for a brief time this afternoon to look at how home care companies are coping with COVID-19 and to point you to some resources that you can use to help your agency continue to serve your clients and your caregivers. As we've continued to focus on this process, we realize that part of coping with COVID is, first of all, protecting your clients and your caregivers. And so we're going to come back and take a look at some resources for policies and procedures to help you make sure that you're doing what you need to do to protect your clients and your caregivers. We're also going to be addressing the shortages of personal protective equipment. And in the last week, since our last office hours, it seems like some of those shortages are easing and there are more resources available to you to find personal protective equipment for your caregivers. We'll also talk briefly about operating remotely and some things that you can do as a leader to lead in this time of crisis. We'll talk about keeping your caregiver recruiting and interviewing and onboarding process going remotely and some tools and resources there. And then we'll deal with some of the legal and regulatory issues that are popping up as we go forward. In terms of policies and procedures for protecting clients and caregivers, I want to point you to another resource, which is the Home Care Association of America website. And I'm going to minimize this part of my screen and go to this website. This is hcaoa.org and their coronavirus resources page. And if you have not been there, I would encourage you to go there fairly regularly because there are some new resources that they add to the page, and particularly as it relates to personal protective equipment. There's just in the last couple of days, they've added some contacts for personal protective equipment that have been referred by members of HCAOA and their steering committee. And so community attire, SNI Today is a resource, Radiant delivers, Care Express products, RCR Development and International Trade and Finance, Veterans Care Coordination, GTXO, and then Preferred Benefit Consultants. So there's some resources available. I see they added a couple more here on the bottom, Viral Protection Labs and Gary Paul. So there's links to websites, there's email addresses, there's phone numbers. And so if you're looking for personal protective equipment, I would encourage you to go to the HCAOA website. In terms of policies and procedures, the website also has a series of samples of policies and procedures that you can model and develop your own policies. We also are learning that it's wise to get legal advice from your local counsel who's familiar with the regulations and the laws in your own state. And if there are any particular requirements set up by your municipality, your city government, your county government, because we realize that there's all kinds of different rules and regulations across the country that will affect you. And so making sure that your policies and procedures address those local and state initiatives. There's also some information from Home Care Association that's been pulled together by their steering committee in conjunction with the CDC guidelines. And so there's some tools. Here's a sample of home care recommendations for no exposure. So I would encourage you to take a look at those resources on that page. In terms of policies and procedures, we were just talking before the program, a number of us today were on the Thursday noontime Eastern time webinar provided by the Home Care Association of America, the National Association for Home Care and Hospice, and Littler Mendelsohn. And a number of us were on that webinar today, and they gave us some great insights about policies and procedures, things that you need to anticipate and prepare for. We've also been working with members of our mastermind groups, looking at the types of policies that home care companies need to be putting in place and reviewing. So things like the use of personal protective equipment. And the attorneys made some interesting observations and recommendations about the voluntary use of N95 masks, because apparently there are some potential hazards to caregivers who have respiratory issues that go with the use of those N95 masks. Guidelines and policies about screening caregivers and clients at the beginning of a shift. And several of the software companies have built in a caregiver screening and a client screening tool right into the care plan and into the login process for their electronic visit verification systems. So developing policies around how you screen your caregivers before they go on to the shift and how they screen their clients at the beginning and end of the shift. Also having policies and procedures and then communicating and providing training to your caregivers in terms of how you as an agency will respond if you suspect that there is COVID exposure. If a caregiver has been exposed, if a client has been exposed, if a family member of a client has been exposed, and the precautions that you need to take. Also having a policy for what your response will be to confirmed COVID-19 positive cases. If you have a client, for example, that's confirmed as positive, how you will address that. And what if a caregiver is confirmed positive? As I've talked to many of our clients and our mastermind members, it seems like one of the biggest fears in our industry is the fear that a caregiver will be a carrier of COVID and will expose a client who then has a major complication or passes away. And now we get into the whole potential for wrongful death. We did learn today that the life care community in Kirkland, Washington, that was the first senior living community to have a significant number of cases, have been sued in the first wrongful death lawsuit. So that's been, what, about 3 weeks ago that began, and already the lawsuits are happening. And it seems like the attorneys that I've been hearing from are saying that the biggest risk to home care companies is not violations from the Department of Labor or from your local Department of Health or other government agency, but it is the risk from plaintiffs' attorneys who may be putting together wrongful death lawsuits or class action lawsuits on the behalf of caregivers and other employees. And then the whole issue of when can a caregiver return to work. And so we're still working and gathering information, but HCAOA, the National Association for Home Care and Hospice, Littler, Mendelsohn, and other law firms are providing tools and resources to help you put together your own agency's policies and procedures for dealing with these kinds of issues. We mentioned personal protective equipment, and last week we mentioned Veterans Care Coordination had sent us some information. The link to their site is now on the HCAOA site. And so if you need personal protective equipment, there's a series of links that we just read off to you available at that site. One of the things that we've been talking about and thinking about and providing more guidance on is operating remotely. We had a newsletter article and blog post this week on Leading in Uncertainty by my wife and my business partner and best friend, Elizabeth Jeffries, who is an RN and an award-winning professional speaker. Elizabeth is also an executive coach to C-suite leaders in hospitals and in academic medicine and schools of medicine. And so Elizabeth has written a 3-part series for us on leading in uncertainty. And the first part came out yesterday. If you're on our newsletter list, you would have seen that. If you're not on our newsletter list, you can go to leadinghomecare.com and click on the link for Home Care CEO Report, and you will find the first article of that 3-part series about staying connected with your, particularly your office team members who are working remotely. For you, it may be very comfortable to operate from home as a business owner or a leader, but your office team may not be as comfortable doing that. And part of it is the technology of getting access to your scheduling system and your telephone system. But the other part of it is helping people develop a place to work, having a routine and a pattern, having a routine for when they start work and when they take breaks and when they end, recognizing that there are lots of distractions in the home, and working from home is very different than working in an office setting. Also, I don't know what your experience is, but my experience is that it can be lonely working from home, and so giving your office team members working from home the opportunity to stay connected, not only with you and other managers and leaders, but stay connected with one another. So there's some tips in that article and in the following 2 parts of that 3-part series. The other thing that we've been really focusing on with a lot of our mastermind members is how to keep the caregiver recruiting and retention process going forward while you're not able to do interviews and orientation face-to-face. And so again, there's a technology solution that has to do with gathering applications, processing applications, doing initial screening via FaceTime or Zoom or other video chat programs, how you will do your formal interview process. And we're finding that this is an excellent opportunity to really step back and talk with your recruiters and your supervisors about the interviewing process and to really fine-tune your interview questions. And we're doing some work right now on what we call the caregiver quality recruiting process to really look at what we can do digitally to recruit caregivers. This is also an opportunity to re-emphasize your employee referral program. All of our data show that the #1 source of high-quality caregivers is going to be other employees, particularly other caregivers. And so by having a focused employee referral program to get your employees to refer applicants for caregiver positions, it's also a time to revisit the incentives that you will be offering to your employees when they do make a referral. Some of our members are actually providing not only a referral bonus to their employees, but a sign-on bonus to caregivers. The other thing we're seeing right now is, because of the unemployment in other sectors of the economy, we're seeing significant increases in the number of applicants, which mean we really need to look at our selection process. And our Caregiver Quality Assurance Program that we developed in 2006 is a program that we developed specifically to address this question of selection. And we're now going back and reviewing all of that to help clients and mastermind members review and revisit their selection process, do a better job of interviewing, do a better job of screening out applicants. And we're seeing that the overall quality of the caregiver pool in many organizations is going up. And so then retention becomes an important issue, because if you're getting high quality applicants who become high quality caregivers. We want to retain them, and we don't know yet what's going to happen as the COVID crisis passes, unemployment begins to shift again, and will these new caregivers that came on board stay as caregivers, or do we go back to doing something else? So looking at launching and relaunching and revising and refocusing your recruiting and retention process will be an important part. So if there's any of those things that you have questions about, we can help you with, feel free to type your questions into the chat bar. We're going to take some time in a moment for live questions where you'll be able to ask your questions, and we'll help you as much as we can. The other thing that we talked about a fair amount last time was the Family First COVID Recovery Act, Coronavirus Recovery Act, I guess is the formal name of it, but particularly the aspect that relates to emergency paid sick leave and emergency paid family leave, the sick leave being 80 hours, the family leave being 12 weeks. And last week we learned that home care companies are exempt from the requirements of this law, but that we do have the opportunity to waive that exemption and in fact provide both paid sick leave and family leave. This week we learned more about the fact that there have been at least 2 lawsuits challenging the exemption for healthcare workers, one by the state of New York, which means there's a little bit more uncertainty out there about the exemption from the paid sick leave and family leave. And so still you have the option of taking the exemption or not. And this is something that we think we're going to study further, and we're going to have some conversation about that in just a moment with some of the guests who are with us. And then the other issue that we talked about last week is the Paycheck Protection Program. And if you applied through your bank to the SBA, you probably have received an authorization by this time. Some of you probably actually have received a check. We have several of our members who actually did get money deposited in their account for the Paycheck Protection Program. So these are the hot issues that home care owners are dealing with and concerned about, and we're wanting to be a resource to that. And so we have some folks on here who agreed to have some conversation. Glenn Lane is with Westchester Family Care in Mamaroneck, New York. Glenn, thanks for being with us.
You're welcome. You're welcome, guys. Good to see everybody. Yeah,
so
we were
Glenn,
talking.
Tell us a little bit about what you're seeing with the personal protective equipment and caring for clients and caregivers, and what have you done with regard to some of those policies?
Great. Yeah, so some of it has been driven by regulation, and then some of it has just been driven by what we thought at the time was a better practice that kind of evolved into a regulation. So for the last several weeks in New York, we've been asking screening questions to each caregiver before each shift about potential exposures. I've opted to do it manually. I've looked at a couple of systems, and in fact, I bought a system for occupational health in general. We're using that more for tracking, but I like the idea in this environment of extra communication with the caregivers and in fact with the clients as well. So we've been doing that for several weeks, and then about a month ago we added in taking temperatures before each shift as well. We did find that a lot of our caregivers didn't have thermometers. Kind of interesting. We sorted that out with some difficulty. Getting thermometers nowadays is not the easiest either. In New York, we always used the surgical masks, the loose-fitting masks, for caregivers who did not get the flu vaccine. So at the beginning of each season, I would buy 10,000 of those face masks, and then we'd go through it. We'd have supervision around it. I paid $378 for 10,000 masks at the beginning of the flu season. Last week, I got a bargain and paid $2,900 for 5,000 masks to get us through the next round, which is now we're requiring every caregiver to wear masks for every shift, and ideally not to reuse. The bar has gotten lower and lower, unfortunately, in terms of the reuse of things that weren't intended to reuse, but we're trying to maintain that, at least with the surgical masks. We have not taken a positive client yet. I still don't feel we're ready to, although I would want to save my equipment and my caregivers for when an existing client becomes positive, so we don't need to leave them. We have a small supply of the N95 masks. We've sent our nurses and some caregivers to be fit tested for the proper use of those masks. And we have one case that has come on now, which is a client who was positive, who is presumed not positive at this point. He's been 14 days without symptoms before we took him on, 3 days without a fever, without any help of Tylenol. And that caregiver is wearing the N95 mask as well as face shield and gowns and the like. So it's definitely ratcheted up. Tremendous amount of overhead with this in terms of just the mechanics of getting the supplies, then getting them delivered to the caregivers and clients. We can't have people come to the office anymore for them. And then, as we were also talking about earlier, these different situations that come up with people who are missing work for different reasons. Where do they fit in? Do they get paid? Don't they get paid? Which of the programs or which of the classifications does it fall under? So between the equipment and now working on maintaining the workforce, even with reduced hours, has become quite challenging, and really does put the emphasis on this recruitment that Steve is talking about here.
And Dale, who's also on the screen, typed in a question, Glenn, about are participants bonusing for retention purposes, and how are they structuring those, and also to keep payroll levels up for the SBA forgiveness. We'll talk a little bit more about the PPE in a moment, but I know in our mastermind group the other day, we talked about some of the companies have raised base rates for a defined period of time. Others have added on bonuses and other approaches. What are you doing, and what were you hearing the other mastermind members talking about?
Yeah, so there's two different things that I'm doing, partly out of a good practice and partly to be kind of consistent with what we're going to need to show for the PPP forgiveness. One is every day we are losing caregiver availability for one reason or another, and the phone is ringing a lot. So I'm getting 10, 12 inquiries a day now. There's probably 2 or 3 a day that are legit. Legit meaning not cases that I could handle, that are within my parameters of minimums and rates and everything. So I want to be able to maintain caregivers that are ready to go, that are committed, and basically by having those caregivers paid to be available, to be flexible. I do separate out caregivers that are working in facilities from those who are working in homes as best we can. So I've always had 1 or 2 on standby like that. Now I want to get that number up to like 10. And I also have caregivers that have lost their primary job, that in New York they could collect $1,100 a week in unemployment and just minimize the amount of time they work for me. I want to compete with that and have them look at me as an option for that. So that having that bench on standby relative to your size, whatever makes sense for you, is one thing. And then the second thing is figuring out a way to increase the wages temporarily. And those things are always very hard to roll back. So it's not like I'm just going to say I'm going to pay an extra, I'm going to pay 17 instead of 15 or whatever it is in your area. It looks like I'm going to roll out a COVID bonus arrangement that is based on hours worked. What I'm looking to do now, I want it to be timely. I want them to get it right away. So they'll work whatever they were going to work in a week. In the following week's paycheck, they're going to get a bonus based on the number of hours they worked, a fixed bonus across the workforce. There'll be an amount for every regular time hour they worked and an amount for every straight time hour, overtime hour they worked. That'll be 1.5 times that. And what I'm hoping is to help recruitment, help reactivate people who are not active, and stop the negotiation for each shift. So we're wasting a tremendous amount of time where each arrangement, whether it's in the home or a facility, positive, not positive, becomes this negotiation that I just want to stop. And so those arrangements that have been made already, I'm honoring. They'll be subject and eligible for this bonus, but then going forward, the coordinators will know that the bonus is out there. That's what we're doing for this next 8-week period to incent people to take this work. And I'm thinking it's going to be probably $1.50 or $2 an hour base, $2.25, $3 an hour overtime to get me up into the, the high teens basically in terms of my average rate.
And I think what you said is really important, Glenn, is that you have not moved their base rate, but you're bonusing on top of that during this time period, so that it's not like you're going to boost their rate to $17 an hour and then at the end take them back down to 15. They've always been at whatever, if it's 15 or 12 or 10, whatever, geographically, and the bonus on top of that is an incentive for them to continue to work.
Yeah, yeah. And we've gone and we talked about this in the mastermind meeting this week also, a lot of back and forth about what to do with the client side here. So many of us have gotten cash or will be getting cash, but yet it's gonna go out the door fast, unfortunately. And realistically, we're paying more for workers now. We're paying more for supplies. There's an overhead on our office. What amount of that should be borne by the clients, either temporarily or, in a more permanent rate increase? And that was also a big discussion. So many of us are doing, and I'm not doing it yet, but a temporary increase, which on the face of it would largely go to the caregivers or potentially could go to some of the equipment that we're dealing with now.
Very good. Thank you. One of the questions that we talked about in the webinar earlier with HCAOA and Littler was this issue of opting in or opting out of the family leave provision of the CARES Act. Glenn, I know you do a lot of studying of those kinds of things, and what's your take on what you see companies doing and what you're thinking about doing with regard to that?
Yeah, I'm getting more and more convinced that even though we fought very hard for the exemption, and even though on the face of it economically the exemption will help us, it's employee unfriendly, and in an industry that especially in New York, an industry that is known to be class action friendly, litigious friendly, and the caregivers are viewed as these oppressed people. And again, we saw that article today from the SEIU conference, the largest workers union in the service space, that I think my view is to opt out. I think it's inevitable there's going to be challenges, and now we heard today that there are lawsuits here, but we're basically being forced in a very employee unfriendly situation. So we're having caregivers, I have one going on right now, basically, that the client ultimately tested positive, the caregiver subsequently tested positive, and so technically I just need to pay her the sick time that she accrued for me. I do have paid sick. I've had it from the beginning, regardless of whether it was mandatory, but that's 40 hours. The likelihood is she's going to be out for at least 2 or 3 weeks, and then there's going to be something going on longer after that. So to say to that person, you're on your own, I just don't think it's the right thing to do. There is a debate also, and I don't have clarity on it yet. If you opt out of the exemption, are you opting out of the credits that you might get for those payments? And so I think there's a little bit of a question around that. And I think there's also a little bit of a question, or maybe not such a question, around if you opt out, you get the PPP loan, can you still take advantage of the credits, or is the use of the PPP loan in a forgivable way for those payments basically the government payment for you there? I had a situation today, kind of unbeknownst to me, where I set up the pay codes for the paid sick. I have been paying it out, and I noticed on my tax deposit for this week, the payroll company had reduced the tax deposit by an amount on the face of it I couldn't tie out to. And so without asking me or confirming whether I had the PPP or not, or whether I was exempt or not, the payroll company presumed that I was going to take the credit. So that is something for everyone to be aware of. So you want to be deliberate and thoughtful about this. I was surprised that that happened without any really interaction with me on it. So just something to be aware of.
And so it suggests importance to be in touch with your payroll company or your payroll processor on those kinds of issues. And being aware, now there is and I can't remember, did they put through the provision to delay payment of the FICA, the company's portion of the FICA taxes?
And that's what I'm referring to.
Yeah.
As the way, again, I mean, there's some very smart things that were done here in terms of, there's so many of these things you can talk about, tax credits and things like that, and you've got to wait for, classically, you've got to wait for your return and things like that to benefit. But really the fastest way they can get money to us, aside from things like the PPP, is to reduce the weekly tax deposits, and they did. So it's very creative, but I think between the payroll companies and our accountants and attorneys, we just need to make sure that we're even unintendedly not double dipping and using things the right way. And ultimately, if we don't, one way or the other, it's going to burn us. We're not going to have the right tax deposits in. We're not going to have things qualified enough to get the forgiveness on the PPP. One way or the other, we just need to make sure we're deliberate and compliant.
Very good. Well, thank you, Glenn. I appreciate that. The other area that I know you did a lot of research on was on the PPP, and I know you were early on in applying for that. It looks like the money is all spoken for at this point. If people have received their approval from their bank via the SBA, that at some point they will get that money. What's your take on that now based on what you've seen happening?
It's been one of the more remarkable processes I've ever seen in my life. It's a huge amount of money. There's a huge amount of businesses that are, eligible for it. There was a lot of hesitancy, interestingly enough, in our groups, and I have another CEO group I'm part of outside of home care, where people were spending a lot of time analyzing the forgiveness and everything else, and it's just, we couldn't believe it. We will never see this again in our lives, basically, that someone's just walking up to us with a large amount of money. In our business, where our operations are still continuing, we're going to be impacted. We have huge risk. I'm not saying we're not entitled to the money, but yet if we were all in a bar a couple of months ago before a mastermind meeting, seeing that, okay, someone's going to walk up to us for several $100,000 in some cases, and we don't have to pay it back, what do you think? And it's like, and so I guess where it goes though is that there's been toing and froing with the banks. The government had taken actions to do it, and then parties, I think, were going back and forth on the supervision of this, and that caused a lot of the larger banks to take pause for a bit. The Fed stepped in. They're going to buy the loans. They're going to finance the loans, and then that kind of opened up the floodgates. But it seems like the larger banks, which are typically who we bank with, are extremely backlogged, even though they have the automation, they've got the scale. Many of them made decisions only to look at their own clients at all or initially. And I personally ended up going to a few different banks of different sizes and shapes. And interestingly enough, we were introduced to a large SBA lender called Live Oak in North Carolina that really is just a lending bank. They take some deposits, but really they're an SBA lender with lines of credit, and they just turn these things over. They have a home care vertical. They do a lot of the franchises. We were introduced to them, and then they made a decision only to deal with their lenders or their borrowers. And then Saturday, they sent an email out saying, okay, we've satisfied the demand of our internal borrowers. You can go ahead and apply. It's PDFs on paper, scanned in, send it to an email address. Saturday, I sent that in, and Tuesday, the money was in the account, and I literally, with my own bank, I've applied, I'm in a queue, but I am nowhere that far along. So I've had other lenders respond, but nothing with that speed. And there is a lot of back and forth on applying with multiple banks. In the end, when it gets to a certain point where they've pulled the SBA number, the E-Trend number, that is in essence the thing that the SBA uses to dedupe and kind of reserve the funds, the next lender that gets to underwriting with you will get blocked. They'll know that you have another loan out there, and I think it's an ugly process to unwind. I had a little debate about the funding amount was a little bit lower than I was hoping or than I had calculated, but in the end, like I said, people are not having someone walk up to you with that kind of money, maybe a little lower than that original calculation was. Just get it done. So I guess the point is that if you've got something in the hand and you're debating, just move it forward. And if you still haven't applied yet, go ahead, get something in somewhere. There is going to be another round of funding here. Ridiculous number still being talked about, another 250 billion to 500 billion. So I guess that's the advice. And don't worry if it's a bank you haven't heard of. If they're active, they're in your community, they're doing this, just get it in.
Shifting gears just a little bit, Dale Brock, who's with us, typed in a note that says, guidance we received on the tax credit is you can't include COVID sick leave in PPP use and take the payroll tax credits. Dale, you want to tell us a little bit more about what you learned there and what your decision was?
Well, we're not exercising the exemption, so we are doing both the COVID paid sick leave and then the COVID paid expanded family and medical leave. It's a pain, very fairly administrative, heavy, particularly on the front end, getting policies out, request forms out, employee communication. But our payroll companies made it pretty easy to, they built and programmed some reports where you could do the 6-month look back with just literally 2 or 3 entries to build a report to come up with the regular pay rate, because most of our employees are part-time, and you have to go back 6 months and look at their average hours and calculate an average regular rate that you would use to pay them for the time off during the 2 weeks of the sick pay. So that helped a lot, because that was giving me a headache trying to figure out how we could do that otherwise. But you can put sick leave in the PPP as far as what you use the money for, if it's non-COVID FFCRA sick leave, because when they submit our payroll taxes every payday or every payday week, they're just going to automatically deduct the amount of sick pay that we've expended from our taxes every week, and it's going to appear on our payroll summary report for that pay period. And then when they generate our quarterly 1049s, you'll also see it there, so that the IRS, when they get that, they don't do the calculation on the gross wages and say, hey, they're short, because there's another line item that shows the credit on there. But if you paid the COVID sick leave, sick pay with the PPP funds and took the tax credit, they're going to consider that double dipping. But your state required, local required sick leave, or your own voluntary sick leave benefit program, you can include those with the PPP expenditures, because that's considered part of payroll.
Related to that, there's another question here that says, my understanding is that allocated and not funded are two different things. Does that mean that the requests have met the allocated amount? Do you have some insights on that, Glenn?
So it was interesting. So we were on the call today where he did a survey of how many people actually had gotten the funding. And I believe 15% of the people on the call had actually gotten money of, let's say, 80% who had applied. And you're right in the sense of there's no, whatever they're saying is gone, it's allocated, it's not spent. I think only a small percentage has actually gone out the door. And that was the frustrating thing generally over the first few days of the program. You know, they're standing there, you know, at the daily briefings, Saturday, Sunday, Monday, Tuesday, talking about all the loans that had gone out. And really, I don't think anyone actually got funded until last Wednesday or Thursday. But yet, your point is well taken. It's allocated. It has not gone out the door yet.
Actually, I was surprised. The quickest one I heard was a member of one of our groups that applied on that first Friday when it was open to a small regional bank in the Midwest, and his money showed up on Friday.
Amazing.
Oh, that was the first one. But as you said, the other ones were then later in the next week and toward the end of that week. I noticed that our friend Bob Roth is with us from Phoenix. He's sitting out in the sunshine down there. Bob, you're on the board of the Home Care Association of America, and I know HCOA has a task force that's been working away. I made reference earlier on, I think before you joined, to the website for HCOA and the resources that are available. But what other insights and wisdom do you have for the folks with us today about how HCOA can help them?
You know, first of all, I've been just so impressed with how HCOA has really stepped up. You know, one, they put together a medical board literally like overnight. You talked about that one person that you know that made their application and got paid, you know, 1 week later. I mean, I think Vicki got working on it along with Emma Dickinson in terms of putting our medical advisory group together on a Thursday, and by Monday we had it all set. I first of all, I want to say how fortunate we are at HCOA to have Vicki Hoke as our executive director. Stephen, and I know some of you guys here on the call know her from the Pennsylvania Home Care Association. It's just, you know, I don't think we could have ever imagined to be in the throes of this pandemic when she joined. But thank goodness that she's on our team. For some of you to know, she was retired. And we brought her out of retirement, and she's working probably harder now than she has ever worked. And she loves home care and loves being able to be a great resource for us. Some of you guys may have seen the 5 program that we put her, and we've done a really good job of pushing that out. I don't know if you talked about it earlier, but there was a webinar that both NAC and HCOA sponsored this morning, and it was last week as well, with Angelo Spinola from Littler Mendelson. You know, I'm just so impressed with, you know, the resources that we have. You know, just the fact that we've all come together in a time like this, and trust me, it wasn't always this way. Prior to COVID-19, this coronavirus, you know, NAC and HCOA, you know, they kind of, you know, they didn't, you know, like when you think of a magnet attracting, they kind of repelled one another. And there was some talk about a strategic alliance, but oh my gosh, I mean, since this has happened, I mean, we are so collaborative. We're working really closely together. I'm just so impressed with how everybody has stepped up, and truly we've got great partnerships. And, you know, when I talk about Littler Mendelson, I should be also talking about Home Care Pulse, and I should be talking about Steve and you doing these office hours with you. You know, I think we've come together really nicely. Just my spin on it only is, you know, I've been at this, my family's been at it for 26 years. I really feel like this is our defining moment. Some of you who may have seen me present before, I always talked about us being the Rodney Dangerfield of the healthcare vertical, and I feel like it's our time now. And it's really sad to see what's happening in these nursing homes. Really tragic in the state of Arizona. We're having more and more deaths, and there's some kind of privacy rule. And I don't know if it's national, but in our state, where, you know, they're reporting deaths in these nursing homes, but they're not reporting where they're at. And I feel so devastated for these families because they're reading these headlines. And if you go to azcentral.com, you'll read about what's happening here in Arizona. And the number of deaths, I think 1/3 of our deaths have happened in nursing homes. And the outbreak, you know, they give you the stats of the number of people that are infected. But if you have a loved one in a nursing home, you don't know if it's that nursing home that your loved one's in, and they're not telling you either. So I bring that up because home care is really the safest option. I think we need to be really, really careful on how we convey our message, because we don't want to throw our skilled nursing partners under the bus. We don't want to throw those assisted living partners under the bus, but we want to message it in a way that we can get out to our communities and our referral partners that home care is the greatest solution for what we're dealing with. But I want to circle back to what you said, Stephen. Real impressed with what's going on with HCOA. Ever since, I'm going to say probably the end of February, maybe the first week in March, we've had emergency board meetings weekly talking about what's going on. How do we navigate in these uncharted waters? You know,
And
the
Bob,
whole
I
world
was,
knows what people.
yeah, I
Go
was
ahead.
really impressed with how HCOA rallied members and non-members, and they reached out to us, and we put it out to our list. Home Care Pulse put it out to their list to get home care owners to click on that link and go through the legislative process of reaching out to legislators with a letter to make sure that home care was included in that exemption. As Glenn said, maybe we don't really need the exemption, but the whole notion that, as you said, we've now popped up on the radar of lots of people that didn't know we existed before. And this is a real opportunity for us to let others know about the importance of home care and what we do and how we do it. That leads to another conversation that Dale and I were having before we started the call, and that is how you're dealing with facilities where you probably assisted living or independent facilities where you had caregivers in there and then they have blocked people from the outside. And a number of our members have gone to the facilities, sat down, shared with them the training that they have done, the preparation that they have done, the precautions that they're taking. And the facility said, well, gee, yes, you can come in and provide care, and we'll make you the exclusive outside provider of care in our facility so that they don't have lots of individuals or lots of caregivers from small agencies. Glenn, being sort of in the epicenter of all of this, what are you seeing with regard to facilities, and do you have some caregivers in facilities?
We do. So first of all, I as best we can, we're trying to keep the caregivers that are working in facilities separate from caregivers working in homes, so we don't bring, let's say there's some amount of additional risk in a facility, albeit some of our caregivers that work elsewhere might work in a facility on their own and then come to work for one of our clients. But net, we've had a couple, especially where we were companions in skilled nursing, that they did not let us continue. I think really the skilled nursing and the subacute rehabs really clamped down, and really that's where a lot of the the issues have been. The assisted livings and the independent livings all blocked visitors, but we were able to work things out, to your point, with meeting with the facilities, with providing documentation on their their training, their credentials, their medicals, and so we have been continuing that. It is a higher stress environment for the caregivers in terms of, to Bob's point, at all the facilities we've been in, 5, 10, 15 cases, and these are very high-end, CCRCs and the like, but none of them have been spared. And so we're working with a client who's locked in her room. She's got no symptoms. She's not, really hasn't been exposed. And on either side of her down the hall, there's boxes for the PPE in a similar way you'd see in a hospital isolation room, where her neighbors are suspected, and we've had a lot of angst with the caregivers, going in there. But for the most part, those cases have continued. It's more the rehabs and the skilled nursings where they haven't.
Okay, good. Thank you for that. We've got lots of folks on here listening and observing. If you have questions about any of the things that we've talked about, click on the chat box at the bottom of your Zoom panel and type in your chat messages, any questions that you have, and we'll be happy to address that. Bob, here, go ahead.
Yeah, I do have a question, and I know I sent you and Jill an email earlier about it, and again, I apologize for coming in about halfway through. It's interesting. PPE is something that has been very foreign to us in non-medical home care.
Right.
And now all of a sudden, the whole world knows about it, and there obviously was a shortage of it, and it was hard to acquire it. But now that many of us have been able to get our arms around it, and we are utilizing it, I'm just curious if I could just take a poll, and Glenn, I know you manage a pretty substantial business. How's everybody dealing with PPE in terms of not so much recovering the cost, but there is a lot of cost and money that went into it. I will tell you, I probably spent the last 6 weeks, at least 10% of my time capital trying to find it and pay for it and bring it in. Now, we're mandated to send it out, especially in Southern California. Essential workers have to wear masks, and we're trying to do it across the spectrum over at Honor and here at Cypress. Are you finding yourselves just absorbing the costs, or are you finding the opportunity to at least recover the costs and charging a fee for that on a per hourly basis or per shift basis? I just would like to get a sense of what's going on out there in the marketplace by the individual agencies.
It's this whole question of recovery, whether it be recovering costs for paying caregivers more to do the work, especially in facilities, is an interesting one. And this question of the equipment, which we're clearly paying more for. I was saying, so I need surgical masks by regulation in New York for people who don't get the flu shot. So each season I buy 10,000 surgical masks. I paid $378 for 10,000 masks in October. On my last buy, I paid $2,900 for 5,000 masks last week.
Wow.
And it is a real question, and I've been going back and forth on both sides of it, how to come up with something intelligent to incent the caregivers, and then also what amount of this should be borne by the clients. In the old model, we wouldn't charge for OSHA required equipment, but now here we are. The requirement has ratcheted up, the cost have ratcheted up. It is very meaningful. And I'm having a lot of discussion now. I haven't gotten to closure on it yet. I am doing a temporary bonus for the caregivers. I'm debating about a temporary rate increase for the clients or a specific charge for equipment, per what you said. But it's very time consuming. Even with the New York State has programs where I can get a certain amount of equipment at no charge, assuming hospitals and nursing homes are taken care of. And I make a weekly trip to this operations center and pick up some fraction of what I need at no cost, but it's not everything I need.
What we've seen, Bob, and I think that's a great question, is a range of things from people who have done nothing and are absorbing the costs to some people who did almost immediate price increases with a letter to their clients that said, this crisis is hitting, we're having to provide extra personal protective equipment and paid leave for our caregivers, and outlined the additional expenses and said, effective this date, we're going to increase our rates by $1 an hour, $1.50 an hour. Other people have put on a line item surcharge. So they have the regular hourly rate and then the surcharge for personal protective equipment. And for the most part, they've found that they've gotten minimal pushback from clients. A few people ask some questions. You know, you get one phone call, the person who said, well, my caregiver isn't wearing a mask. Why do I need to pay the extra $1 an hour? But the pushback has been minimal. And for the most part, clients understand what's going on and they say, yep, I'll just pay the extra. So I think, as Glenn said, it's an individual decision that each company has
Sure,
to
it
make
is.
based on the relationship with your caregivers.
And I think it's interesting to note too, Stephen, is just, you know, I think we're finding the same thing. I think customers are just grateful to get the care. And, you know, look, you know, they understand that these are trying times. I'm just, you know, we all have different approaches on how we're dealing with this. So that's why I was just curious to how people were doing this. Were they absorbing the cost? Because let's face it, as an employer, it's our responsibility to make sure we provide a safe work environment for our employees. And whether they're working in our facility or our offices, or they're working somewhere else. So certainly the onus is on us, but also others do say that it's incumbent upon the client to be providing the PPE equipment. You know, Stephen, you know, I do a little bit of Medicaid business, and I will tell you, one of the managed care organizations stepped up and gave just the EPDPA group, which is the Elderly and Physically Disabled Provider Alliance, gave us over 10,000 masks for us to divvy up to everybody so we can get it out to all the members. So, you know, it's that, you know, who bears that burden? Is it supposed to be the employer, or is it supposed to be the client? And you know, I just wanted to get a vibe.
Yeah, Carrie writes a note in the chat box. We're absorbing the cost of safety equipment. We have a contract with the VA. I'm not sure they will cover the cost. And then she asked the question, is anyone using shields? And I think, Glenn, did I hear you say you have shields and gowns and for caregivers that will be caring for COVID positive clients?
Yeah, I haven't done an actual active positive, but I've had some in different stages. And for those, they're using the face shields, the N95 masks that have been fitted, as well as gowns.
Okay. And on the call, the HCOA NAC call today with Littler Mendelson, they talked about having a specific policy for caring for a client that tests positive and the specific equipment that will be required to go in there. And obviously we have to provide that. And so they're saying that one of the conditions on which we would accept a COVID positive client is that we can get the personal protective equipment for our caregivers. Here's a note from Bill James, who said, I spoke with the guys in Philadelphia who we bought surgical masks from. They're out of stock now, but should have more delivered to them mid next week. If you need sanitizers, they have plenty of that. If you need masks, email them to get on their mailing list, and it's in the chat box. So if you need equipment, there's the email address, kfintrade@gmail.com, or the phone number. And so there's a resource for you if you need personal protective equipment. We're coming up to the top of the hour. It's been a great conversation this afternoon. If you have other comments or other questions about any of the things that we've talked about, go ahead and type that into the chat box and we'll answer your questions. Let me just go around and see what other thoughts you have. Dale, appreciate you being with us. Any last words of wisdom for the group that's on here?
Not really, Stephen. Just stay safe and take care of your own body. I'm trying to get, still trying to get a good night's sleep and keep my immune system functioning in spite of a little extra wine occasionally.
Well, that's antiseptic, right?
It is.
All the bourbon distilleries in Louisville are making antiseptic out of their raw alcohol. So I don't know if bourbon counts as antiseptic, but anyway.
Well, and my new Concept 2 rowing machine arrived yesterday, so I got to put it together and get after it. So that's
okay.
my advice.
Okay. Glenn, thank you for being with us. Any words of wisdom you have for the group before we go?
No, I echo what Dale said, and you know, we really do have to take care of ourselves and our loved ones here while we're juggling, you know, everything else. And I think the thing we didn't talk about today, and maybe we can talk more about it next week too, is there is an opportunity here that you know, I've continued to market, albeit digitally, continue to take new clients. We're continuing to recruit and improving our recruiting processes, making them more virtual. We're seeing a lot of inquiry from clients with private caregivers who have abandoned them. And I think down the road, even though they're some of our best referral sources, I think people are going to be hesitant to send loved ones to facilities, especially the early stage independence and assistance based on this. So we're in defense mode right now, but I think there's a huge recruiting opportunity here, and there's a huge marketing opportunity here that we've got to keep in the back of our minds.
That's a good point, Glenn. We had a very interesting conversation in one of our mastermind groups the other day about specific things that members are doing to reach out to their best referral sources. And so, for example, one member said, well, I have a very clear list of my top 20. And I made a point to reach out to them in a variety of different ways, not so much to say, do you have any business for me, but to say, what's going on with you? What are your challenges? What can we do to help you and support you? And we're open for business, and we've got the personal protective equipment, and how can we help you? And they've been pleased with the response that they've got, and they have gotten some referrals just by doing that reach out, whether it's an email, a text, a phone call, a personal handwritten note.
And I might add, Stephen, we're doing Zoom or FaceTime. I think this is so important. It doesn't need to be 15 or 20 people, one-on-ones, and seeing the person and being genuine and asking them, how are you doing through all of this?
Right.
And not making it a sales type presentation. I think it goes a long way with your referral partners.
And that's a point that Elizabeth made in the article that I mentioned at the beginning. In leading in difficult times is making phone calls to individual members of your team who are working from home just to check on them. How are you doing? How are your kids? How are you dealing with the loneliness, the depression, the whatever else you're experiencing? And so as leaders, this is a time for us to step up for our caregivers, for our clients, but also for the members of our office team who are now working from home. Well, we're squeaking past the top of the hour. We honor your time. Thank you all for being with us today. We'll be back next Thursday, same time, same station. So join us again for office hours. If there's anything that we can do between now and then, please feel free to email Stephen, S-T-E-P-H-E-N, @leadinghomecare.com or Jill@leadinghomecare.com. If you have topics that you would like us to discuss next week or in coming weeks, again, shoot us an email and let us know, and we'll do some research and get some information for you. Thanks everybody for being with us. Be safe. We'll see you next week.